Good afternoon, everyone.
Hello.
We'd like to call this meeting of the Special Commissioners State Institutions to order. My name is Matthew Willett, Matt Willett. I'm one of the co-chairs of the commission, along with Evelyn Mateos. As before we begin, like usual, we'd like to inform everyone the commission is meeting subject, to the open meeting law. And that a vote taken will be done for a roll call via roll call. So I just woke up 45 minutes ago, so I still haven't actually waking yet. We're via roll call. We ask commission members, please mute yourselves to avoid background noise. We also encourage everyone to use the raise hand function if they'd like to speak. I'd like to highlight a meeting being recorded and the videos are available on the Commissioners Mass Web page. To open this meeting, ensure access to all participants. We ask the following. Please take a moment to view the agenda. The items on there that we discussed today. We have CAT services supporting our meeting today. The captions that help participants follow the discussion. If you need any help turning this on, please let us know. We ask you to speak all in few acronyms as possible. Do so will help all participants to understand important information that is shared. Emily and I will try to remind folks, especially myself, to keep this meetings, keep this on track. When we end this meeting, we have notes made available based on what we talk about. I have a few announcements about this commission. First of all, one of our members, Judy Salvador, retired as CEO of Northeast Independent Living, so she resigned from the commission. Then another commission member, John Hamilton, left his position with the archives, so he stepped down from the commission. But we'd like to introduce Connor Snow, who took his who was stepping in for the archives representative of the commission. So thank you. Emily, I'd like to say something.
Good afternoon. Before we start the afternoon discussion, we have the additional housekeeping item, which is to vote on the draft minutes from the commission previous meeting on September 6th. Copies of the draft meeting minutes were emailed to members before the meeting. One member emailed us to ask that we change the draft minutes so they accurately reflect that at the commission first meeting on June 1st, a member asked that we use plain language whenever possible in both documents in our discussions. Are there any other suggestions, changes to the draft minutes? And if so, please unmute yourself and state your proposed change. Okay. If there are no changes, we can vote. We will be conducting a roll call vote. So if everyone could please unmute themselves, I will call out your names in alphabetical order. First, do we have a motion to approve the minutes? Please state your name.
Rania Kelly, I make a motion to approve the minutes.
This is Matt Millett. I'll second the motion.
Yeah. Sorry.
Sorry, I interrupted you, but yeah, I'll second the motion, Matt Millett.
So I go down the list now, right? Sorry.
Yeah.
So
Yes.
Alice,
Yes.
Kate,
Sorry,
Yes.
if I could just hop in, apologies for the interruption. Alex, I think she was starting with Elise.
Elise, sorry.
But Alex, it did sound a lot like Alex, so I don't blame you at all. I just wanted
I
to.
just, I want to be Elise. That's the thing. So it's,
I don't believe Elise or Brenda are able to join today.
Okay. Kate,
Yes.
Reggie,
Yes.
Ann,
Yes.
Alex,
this time, yes.
Raina,
Yes.
Andrew,
Yes.
Mary, Mary. Okay. Vesper, Brenda, Connor,
Yes.
Mary Luce, Matthew,
Yes.
myself, Evelyn, yes. Thank you, everyone. And just as a reminder, copies of the approved minutes and all the meetings materials from our commission meeting are available on the commission webpage.
Oh, thank you, Emily. As last month's meet, well, is the other month's meeting, we discussed a number of options for hiring administrator and resource support for the commission. The subcommittee met towards the end of September. It has the updates for the room. Drew, if I believe you're the only, well, Drew and Alex, sorry, my bad. With what you'd like to speak about the subcommittee, what we talk about?
Sure. Thank you. Yeah, so as you mentioned, we had been we'd been looking into 4 different options about how we might go about getting the administrative support that we need for the commission, that being, you know, some of the functions that Gabe's doing now, the setting up the meetings, coordinating with everybody, putting out the agenda and the draft minutes and things like that. But the bigger aspect was the research, you know, looking into the records, where do they exist? How do we, you know, catalog them? Just getting a basic understanding of the scope of the material out there and how we can best address that. So the subcommittee met a few weeks ago. We reviewed all those options. We also heard a presentation from Dr. Emily Lauer with the Center for Developmental Disability Evaluation and Research, CEDAR, which is a lot easier to say. And, you know, from that presentation, it was our opinion that CEDAR is going to be the most beneficial to get this project done. It's going to be the most efficient means of doing it. They have both aspects that we're looking for. So we did take a vote and we decided to recommend CEDAR as the option moving forward, but ultimately it's the, you know, the full committee has the decision about how we should move forward with this project. But with that said, Emily was nice enough to come and speak today about what CEDAR can do for us and how they might be able to get up and running if we decide to move forward with them. So with that, I'll turn it over to Emily.
Thank you so much, Andrew. I was wondering, yeah, I am able to share my screen. So in an effort to just put something in front of you as I speak, I do have some very simple slides to just introduce ourselves and share a little bit about who we are and what we do. Some of you are familiar faces, so bear with me as you might be hearing things that you already know about us. I am an associate professor at UMass Chan Medical School in family medicine and community health, and I lead the center I'm going to tell you about. My background, I have degrees in medical sociology, which is about the study from a health perspective, about how different systems in our society work together, how different institutions might work, but also how different forces in government and society and interactions all work together. And I also work in public health. So think of the way a doctor focuses on one health, the health of one person at a time. I focus more on the health of a population of people. So that's the background of my work. Within the medical school, we have an independent center called the Eunice Kennedy Shriver Center. As some of you may know, Eunice's sister Rose had an intellectual disability, and our center was founded in 1970 in Eunice's name in celebration of all of the advocacy and work she did to improve the healthcare and the lives and the outcomes for people with intellectual and developmental disabilities. And so we have lots of different experts in our center. We have some that do research to try to provide better science and better health care. We have folks who advocate for better policies and better access to services, better insurance for people with disabilities. We have people like in my group who might study how the health of a population is today and what can be done to improve it, and look at making services better for people with disabilities so that they are able to get the full outcomes that they're looking for in their lives and live in a more integrated fashion. And so we have lots of different experts we can access throughout our center. And I wanted to also share our mission, which is to transform systems, policy, and practice by the research, education, training, and service that we do for a variety of different conditions, so that ultimately the people who have disabilities can lead more self-determining lives. So I've spoke with your smaller group about some of the work we've done so far, and I wanted to share some examples here. We routinely work with people with disabilities and their family members to listen to their experiences and their stories and their lived perspective in order to understand how things really are in practice. So some of what you've talked to us about is needing to understand, what is it like to try to get papers from different groups? What was the experience of going through different processes? And that's something we do pretty well. We've looked at, for example, experiences in social inclusion for adults with intellectual disabilities, where that's gone well and where it hasn't. We did the same thing with caregivers who are aging, who are supporting people in their family with disabilities, and what it was like for them to get help where they needed it, and where they could get that help and where they couldn't. And we use these things to come back and recommend ways that we can improve services. We've also worked with many different self-advocates, some of them on this call even, on creating tools for people with disabilities to express what they need in healthcare, or to understand things about their health that may be challenging. And partnering with people with disabilities, we teach our medical students about how to care for people with disabilities, how to understand and address their needs, and how to be respectful in caring for them as patients. And lastly, I would say that we also have special experience in studying death in people with disabilities. So there are specific ways we do that help us understand where people with disabilities need better health care, better services to improve how long they live, and
The audio is now unmuted.
the health conditions that they experience. So I will pause here for just a moment to see if there are questions. I'm not hearing any questions or seeing anyone indicate that they have questions, so I'm just going to move on a little bit. I appreciate your commission's work to put together the types of support that you would like to see going forward. And I've read that really carefully. and given some thought as to where we can be helpful and where we might not be able to meet what you need. So I wanted to start with the areas we think you can support, we can support. You had asked for 4 areas. One of those is support in running your commissions, which is helping with your meetings and meeting minutes, providing some updates and helping you put together a report. These are things we do every month. And so we have staff who help schedule, who help take minutes, who help write reports. So I do think we can help you with those things. You also asked for help creating a list of places where people are buried and some information about the cemeteries. I do think we can help you find that information and collect it and report on it. You also mentioned that there are papers with information about people with disabilities from the past. And you wanted to know things like, where are those papers and who has them? And I think we can help quite a bit in this area. But as we'll talk about, I think there may be some things that take more time than your commission has right now to figure out. So we can help you get lots of information, but I don't know that we will be able to help you get every piece of information you may seek. So if we can't get it all, what we can do is get as much as we can and explain what needs to be done to get the rest of it. You also asked for help figuring out the process to get those papers, what happens when people try to get them, and how other places give access to papers like this. I do think we can support you in finding the answers to these questions. There's a couple areas that we thought would be challenging, and I'm going to explain why. Sometimes there are processes or ways to get papers that require the help of a lawyer because they are protected under certain laws. They may not be public documents anymore, and people may have ownership over them or think they have ownership over them. Sometimes when we have to help our lawyers help us get those papers, it can take a long time. And it might take longer than when your report is due in January of 2025. We do have lawyers. We can ask them to help us, but sometimes that timeline is out of our control. I also expect that if we were to start asking questions about where papers have gone, if they've been thrown out or destroyed, sometimes people get protective of that information, and I don't want to answer you because they might be afraid they did something wrong or they aren't sure if that was the right process. Working with them may also take some extra time. You also asked us to help find how people were buried when they died, what the rules were, what their families were told. Is there a gravestone and was there a funeral? I think getting this information may be beyond the scope of this phase of the work. We can help you design or write out how we would go about this. But I think finding this information may take many, many interviews, may take many, many steps to fully get this information. We could work with you to get started, but I don't know that we can finish that work in this period. The other part that I think is going to be hard is to find out if anybody was buried in a place where they're not supposed to be buried. I think we can start to collect some information about this, but I don't think we can finish this work in this time period. So some of the things that I don't know yet is where all of this information is, who has it, how we can get it, and whether we need the help of lawyers or other professionals to get this information. So these things will help determine how hard it is or how easy it is to get this information and how quickly we can do it. So I wanted to stop here and ask if you have questions or if you'd like to talk about what I'm proposing.
I just want to comment, this has been amazing so far. I really appreciate how concise and clear everything is.
Audio now unmuted.
Thank you.
Hi, can you hear me okay?
Yes.
Okay, this is Mary Mahan McCauley, and thank you for the detailed information, and I very much appreciate you sharing what you know you can do, what you are pretty sure you can absolutely do, and what you cannot do in the time frame. And that's very, very helpful. You know, whenever looking at any kind of vendor or contract or relationship with someone that's going to do any kind of work, you know, I always appreciate the forthrightness and being straightforward. And I realize some of these things are, you know, there's attorneys involved, there's more money involved, and there's always more time involved. So thank you for the presentation. I think you're able to do a lot of what we need to be done. And, you know, some folks on this commission, and I'm not sure, I haven't been here since the June meeting, but, you know, some folks, as always, maybe thinking we can do more in a short period of time, but this is a major project that's going to take some time. So even all the initial things you can help us with sounds wonderful. And that's it. Thanks.
Thank you. It was really important with me to be upfront
Yep.
with you about what we think we can do and what we can't, because we don't want to give you an impression or give you a sense that we can solve everything and have you be disappointed at the end. We're very aware that this is a very sensitive and important issue, and we want to be respectful of that and ensure that we are very clear about where we think there are going to be challenges.
That's great.
One of the other components or pieces that I know was important to you is to be independent from the state. I also wanted to be honest with you that we are at a state university, and we technically are considered an entity of the state. So while we are not a state agency under Health and Human Services, we are a state organization. I understand if that presents conflict for you, but I want to make sure you have that information at this early juncture or phase, because I am a state employee. We are a state employee under the university system. So we have some independence. You know, the governor does not oversee my job, but it's important that you understand that. And if you have questions about that, I'm absolutely happy to tell you more about that. Well, that was the presentation I prepared for you all. Is there anything you would like to ask me or any other comments you'd like to share? Alex?
Hey, thank you so much for this. It's amazing. And I appreciate just what Rania said, the clarity of your presentation and the telling us the things, as Mary said, that you can and can't do. And I think those are all reasonable things. I had a couple of questions. I might have more, but it's my sense that we have enough funding to get things started. And we can certainly, and we've been encouraged to go back to the legislature for the next kind of fiscal year and ask for the things that we need. Are you able to help us with preparing something small that we could share with them to show us where we're at as we go into that kind of process? And then also give us a sense at some point of kind of what financially we should be going for, so that we make sure that we're able to support ongoing work if we do approve this proposal.
Yes, I did. I am aware of the resources that you have available, and I did spend some time looking at what type of staff support that would afford you. And that's part of how I came up with where I thought we could do things and may not be able to support. In terms of a plan, what I was roughly drafting was a couple different levels of staff. So administrative assistance on scheduling and things, some project management resources, and then some more senior staff who have the ability to write reports, do financial assessments for you about next steps, and prepare a product for you at the end of I think January 2025 is when you had asked for that. That would summarize the work, the findings, and then the next steps, so that you would leave with a product that would set you up for an ask of future support, but most importantly, also understanding the direction you would need to take. Do you need a particular type of consultant, or what kind of expert do you need next, so that you can make an ask that is particular to what we were able to find and what we were not able to find. We also expect that we'll need to do some interviews with people who, for example, have tried to access records and how that went for them. There are also people we know in our professional world who have knowledge about where people are buried and where they are not, and how that was handled. And so we would interview them. So we have resources that we estimated to talk with them and transcribe or get the written word out of what was said, so that we can report on it and pull quotes and things if we need to. And then we also have some resources for kind of local travel, and maybe potentially we need help from a local historian, or a consult fee for someone who's done some background work who we might want to talk to. So that's kind of the support we've been looking at over roughly a little over a year period. And we do think that within the resources that you have available, we can provide that level of support.
Amazing. Thank you so much. And that kind of gets to the other question that came to my mind is, there's a bunch of us on the commission, either who have lived experience with these things, a family member who was in one of the institutions, or family members who are at the current facilities that the state has, people who are themselves at those facilities, and those of us who've done research around these issues. It's not anything you need to answer now, but if there's a process where we can share what we have, whether it's by creating a subcommittee that works with you, or that I don't know, whatever that looks like that's best for you. I think we, I guess that's not a question, but we have something to offer. So that's all I would say.
I am aware that many of you, and Alex included, have spent a lot of time on this topic and do have information gathered. And of course, we would want to incorporate that or bring that in as part of our first steps, to make sure we're building off of what you've done, but not starting over with things you've already worked through.
I have a track record for doing this, so I'll do it again, which is also archives. Connor as the representative, just everything that I've ever been able to do in this has revolved around their sense of both records management and what the state has. And so I know that they are a terrific sort of central resource for our commission. So.
And critical, I think, because it will allow us to get started with what they already know, instead of spending a lot of time trying to figure that out again. I think the Mass Historical Society has also done some work in this area, and we would imagine tapping into what they've done too. That's what would allow us to jump in and keep the work going, as opposed to starting from scratch of where is everything and all of that. I mean, we also, just in full disclosure, we do contract with some of the state agencies to provide support to them too, like the Department of Developmental Services, and then we will be contracting with the Department of Mental Health. So we are independent from them, But I do want to also just disclose that we have professional relationships with them where they pay us to do work for them. That work would not influence this work, but those relationships do exist.
Result the show, right?
I just wanted to add, this is Mary again, the words you just said were wonderful, very, very sweet to my ears, that we're not going to reinvent any wheels. Because working for the state for 34 years, sometimes people start things from scratch when people have already done a lot of different kinds of work. So gathering all the information, there's so much work that's been done in different places at different times that needs to be pulled and put together, which I think will be a big part of what we're trying to do. You know, there's a lot of information spread out, and pulling it together to begin with is critical.
We share that opinion.
Yeah.
Any other questions or comments? Okay, thank you for your time.
Thank you.
Thank you, Dr. Laurie, for your time. I appreciate the presentation. So.
Thank you.
If everyone's happy with Dr. Laura's presentation, is a motion to vote on engaging Cedar to provide support for this commission.
So moved. I'll make that motion.
Do I have
Sorry, can I'll second that, but can I just ask sort of I guess a question in terms of, and maybe this is best directed at Victor. Obviously, somebody's going to need to sign off on, you know, ISAs and things of that nature. So I would ask that the motion be amended just to say that we allow DDS to take any action necessary to, you know, get the contract into effect.
Good idea. Yes, we do have the money, and we'll make sure that everything's done properly with Cedar, and I will manage the contract.
Okay.
And just a question, I'm happy to hop off if you want me to, or to stay on, but if you would like me to leave, that's okay.
Sorry about that, my bad. Don't do this often. Sorry. Yeah, Dr. Laurie, if you don't mind, sorry about that. My
It's
fault.
okay. That's why I'm asking. Thank you so much.
Take care.
Bye.
Thank you. So okay, so I will make a motion. Tell me if I do this wrong, but I'll make a motion that the special commission contract Cedar on the scope of work proposal that we've drafted, and that we authorize DDS to sign any and all contracts in order to finalize that arrangement.
Yep, I'll second that.
I think I'll do a roll call vote then. Elise is not here. Kate?
Yes.
Yes, thank you. Sorry. Reggie? Yeah, mute yourself, Reggie. Sorry.
I'm making a motion that we have that the contract, and also to make sure that whatever is counted to put on paper, please.
Reggie, sorry, what do you mean by put on paper? Sorry.
Well, so that when whatever we do, so we know what's happening, and make sure that we're all accounted for it.
It's on the record.
All right.
Thank you.
Ann?
I agree.
Alex?
Yes.
Arena?
Yes.
Andrew, Drew?
Yes.
Mary?
Yes.
Rest is not here. Brenda's not here. Connor?
Abstain.
Thank you. Mary Lou's not here. I'm a yes. Evelyn?
Yes,
Thank you. Then, so with the motion passed, Victor, EA will work. Oop, yes, Alex?
I believe Mr. Grant is here. I see him
Oh.
on the panelists. So I want to make sure that he's counted in the vote.
Sorry about that.
We can talk about this offline, but Mr. Krant hasn't taken his oath of office, so he technically is not a formal member. Apologies.
I'm sorry about that. Okay, thank you so much.
Okay, so with the vote, it's approved, so Richard and EA will work with Seer to help the next steps.
Certainly.
Thank you. So as I first said when we started, well, one of the first things I said, we are recording this meeting, and I'd like to discuss with this commission where to upload the videos, whether or not we want to do it on our webpage. If we want to do it on our webpage, someone would need to create a YouTube channel to upload everything and put it on online. Something I do not know how to do. So I didn't know if someone on this commission would like to take all that responsibility to create a YouTube channel so we can post our videos.
This is Kate. I would take on the responsibility for doing that, Matt.
Thank you, Kate. Appreciate that. Thank you. So thank you. We'll talk to you later, Kate, about how to set up what stuff. Probably more Dave than me, but we'll set that up. Thank you. Emily, I'd like to talk now, so I just stop.
so we're gonna do the wrap up. Thank you, everyone. I believe that is all we had planned for this afternoon. Is there anything else members would like to discuss?
Just want to thank the co-chairs and Victor and Drew for arranging all this. This is really amazing. It's been a great afternoon. Thank you so much.
Sorry, Alice. I think Reggie tried to say something, if I'm not mistaken.
There you go.
Just want to thank you all for being here and having the support of what you're doing, and we all are working together as a team.
So it's one thing I like to actually discuss. The meetings we last meeting we did every 2 weeks, which we realized is we realized not being able to meet until 2 months later. That is tough. So I know we'd like to revisit that that motion if we want to. Try to keep it every 2 weeks or try to do like every month. I know we want to try to get everything done, but it's tough to get a schedule with 17, 15 people. Especially sometimes people don't answer right away, so it makes it even tougher. So I know if I would like to just to talk more about that. So if ever had other questions, comments about that.
I have a comment. Well, actually, no, I'll wait.
Yeah, speak up, Miss Kelly, please.
Is there any other, I guess my question is there any other pressing matters that we need to do to keep moving forward?
I think with the help of CETA will make our commission move forward quicker. And we don't have to not do as much, but they will help us with our work. So I don't think so, but I could be wrong. That's my impression. Me, Alice, or Kate might have a different impression or thought of that, but I don't think so. I think 2 weeks would be tough, personally.
Yeah, no, I agree. I just want to
Yeah.
make sure the reason we had said it was to the hiring. So
Yeah.
if we're all set, then I'm totally okay with it. I just wanted to ask.
I feel the same, Matt. I think if like Cedar wants us to meet once before the end of the year or something, I'd be down for that, you know, they're whatever they think is best, but I think every 2 weeks, we don't need to. I do think, you know, Evelyn had mentioned the trips out to sites, and Kate, I know we absolutely need as group education some evening where Kate can do a talk for all of us, but certainly we can arrange that scheduling by email, and certainly don't need to keep meeting every 2 weeks.
So is there a motion to, I don't know how to say it correctly, to, sorry, Emily, yes.
I just want to say that earlier, Gabe has emailed every member about the performance of the days and times for regular meetings. If we haven't yet, please email your preferred days, times to me or Gabe or Matt, so we don't go through what we went through. Like, we waited for a lot of response, nobody responded, nobody called back for the emails and texts, and it left us in the limbo, and it's kind of hard to do the job if we don't respond to what we need or want to make it easier for everyone.
And I'll
was-
just, thank you.
That was
Sorry.
it.
Okay, thank you. Andrew Loverell, and just to sort of piggyback on something Alex said, I mean, I think there could be some, definitely, I think maybe moving the large group meetings, the full commission meetings out to, you know, lengthier schedule or lengthier time in between, just because it is tough to get everybody together. But Alex had mentioned maybe getting a subcommittee together just to touch base with Cedar every once in a while, make, you know, see what their track is, check the progress, things like that. So that's another possibility too, just to, you know, have somebody directly engage with them periodically, but then coming back to the full commission less frequently. And we don't have to take that up now. That's just something we could think about.
I could be wrong, Gabe, and Richard help me out with this, but do we need to go back to the motion of meeting every 2 weeks to get that off the books, get another motion on the books?
I think it would be helpful if folks are open to that.
Okay. So do I have a motion to stop, I don't know if I can say this right, but stop meeting every 2 weeks, meet every 4 weeks, or as Cedar would like us? I'm not sure if I said that right.
I'd say maybe we just make a motion to meet at the typically it's at the discretion of the chair. So whenever you and Evelyn want to get everybody together, and you know, call out the meetings and let us know.
Okay. Do I have a second for that then?
I second that. That's a brilliant idea. Thank you.
Right, so I'll do a roll call vote then, for Andrew's motion. Is everyone clear on,
Now unmuted.
is everyone clear on Drew's motion?
Can we do a discussion on that, please? This is Mary.
Sure.
I just wanted to know if would that mean that you're gonna say we're gonna have a meeting next week? Because if there was a short notice, like if they were regularly scheduled, like once a month, I could put them into my book. I book up really far into the future, so I couldn't just fit a meeting in if there was just a decision like, let's have a meeting next week, or let's have a meeting in 2 weeks. I know for my schedule anyway, I'm better off knowing.
Well, I
So
think,
how much front time would you have scheduling a meeting?
sorry, man, I didn't mean to cut you off there. So I think the issue was with 2 weeks, everyone could get back to us and we couldn't make a meeting. So it ended up being, I think, 5 weeks. So what Drew is proposing
I
that,
mean, I think as I heard it, I think it seems like people don't want every 2 weeks, which I would agree with. Every 2 weeks is too often. I would think every month might be fine, just at the beginning, because we're the commission, this organization that we're hiring. They shouldn't be running what we do. They're helping us do what we're doing, if that makes sense to people. So I can, I would be all right with the chairs calling the meeting, but if you calling the meeting and it's like, this meeting's gonna be next week, or it's gonna be in 7 business days, I know I'll have a harder time fitting it in if we have a short notice. So I just wanted to be able to say that.
Yeah, no, it would not be short, well, we try our best not to be short notice. We
So
would be
you-
like, we would be like, hey, can we meet on Monday at 3 o'clock? We'd be like, in 2 weeks or 3 weeks, can we meet on November, I don't know, what, 3 weeks from now, November 10th at 2
Okay,
o'clock?
so
Yeah,
what,
sorry,
so, no, that's okay, no, thank you. So you anticipate that there would be different things and information that would come up to the chairs that others in the group would know, and then you would think, yes, we need a meeting, so you would call a meeting for 2 or 3 weeks, that's what the thought is?
yes, that was.
Okay. All right,
Yeah,
yeah,
we- so
that's
we-
fine, I just couldn't do a quick meeting, and yeah, thank you. I just wanted to clarify that, thank you very much.
Yeah, you'd like to say something?
Yes, I'm gonna say that this meeting should probably meet a week before the large meeting. If the large meeting meets monthly,
So,
Th- th-
yes,
then
sorry,
this should probably meet the week before that, or maybe 2 weeks before that. Just to make sure that we know what the large meeting is all about.
Isn't this the large meeting, the
Yes,
full
I was-
commission?
I was just saying that this is a large meeting. We missed a few people who couldn't make it, and we had a couple of retirees or step downs. So that's why all 17 people are not here.
Well,
that's why-
you should have a small meeting before the large meeting to make sure that everybody knows what the large meeting is about.
Okay. So that would be a subcommittee then, or would that be something else? Because like we would
Nope.
have an agenda set out like a week or a few days before, say what we're going to talk about. That way, hey, papers we need, sorry, I can't talk. Any papers we need you to see, we would send it out a few days before, so you can see what we'll be talking about.
Mhm.
So. Does that answer your question? That's not Ed. Does that answer your question? Sorry, I said that. wrong.
Yes,
Sorry about that. So. Anyone else? Sorry, Alex.
Oh, no, thank you. Maybe Anne, a way down the road is if we do create a subcommittee like what Drew suggested that works with Cedar. If you join that subcommittee, that would probably meet a little more frequently in advance and then hand things over to the chairs who would, organize and lead the scheduling and
Mhm.
preparation of a meeting. So maybe that's a way to be part of that kind of a type of pre-meeting. It's, yeah, just a thought.
Thank you. Thank you, Alex. Any other discussions with Drew? I can't think of the word now. If not, like take a roll call vote.
Yep.
So Elise not here. Kate is to reaffirm.
Yes,
So thank you. Reggie. Yeah, mute yourself, Reggie. Sorry.
Yes.
Thank you, Reggie. Ann.
yes,
Thank you. Alex.
Yes.
Miss Kelly. Because I can't never say it
Yes,
right.
yeah, it's okay, don't worry about it.
Drew.
Yes.
Thank you. Mary.
Yes,
Thank you. Master not here. Fred not here. Connor.
Yes.
Thank you. Mary Luz. Sorry, she's not here either. I'm a yes. Evelyn.
Yes.
Thank you. So thank you about that. I lost my page. So any other discussions? If not,
I'm
Sorry.
sorry, I maybe have talked too much today, but this is Mary again.
Yep.
I have one other comment that wasn't previously anticipated. Just speaking as a person that's blind, as a reasonable accommodation, which I know this group can completely wants inclusion and accessibility for all. I would very much appreciate it before people spoke, if they could say their name.
Oh, sorry about
Because I
that.
can't see them in the screen. I don't know who's speaking. I'm starting to pick up on some voices, but if they could just say their name, I'd very much appreciate it as a person that's blind. Thank you.
Okay, sorry, this is Matt Black. Sorry about that, Mary. My bad. Yes, we'll definitely put that in the notes. So
Thanks.
sorry about that.
No, that's okay. It happens all the time. Thank you. Just wanted to bring it up. People forget things like that.
No other things. You have a motion to adjourn.
Motion to adjourn.
Thank you. We have a second.
A second.
Second,
Thank you. One last roll call vote to adjourn the meeting. Elise is not here. Kate. Thank you. Reggie.
Yes.
Thank you. Ann. Oops, sorry. Ann.
yes.
Alex.
Yes.
Thank you. Miss Kelly.
Yes.
Thank you. Drew.
Yes.
Thank you. Mary.
Yes.
Russ is not here. Brenda's not here. Connor. Oop. Yeah, mute yourself, Connor. Sorry. Sorry, Connor. It's still on mute. So. Can you type your response if you can't get yourself on mute? Oh, just shake the head is yes. So Connor's shaking his head, yes. So Joy. I'm a yes. Evelyn,
Yes.
thank you. That concludes this commission meeting. We'll work with CETA to get the ball rolling, so to speak. We'll hopefully talk to each other soon. If as always, any questions, you email me, Evelyn. Our email is always open. So thank you, everyone.
Thank you. Have a nice weekend.
You everybody have a good weekend as well. Take care.
Bye-bye.
Goodbye.
Here, everyone.
Bye, everyone.
Bye.